We are at the Sardinia Dental Teaching Center in Cagliari, Italy, and we are running our 4-day course on stress-reduced direct composite restoration. Joseph Sutton is from Tennessee, and he would like to share his experience during this 4-day course.
Thank you. This 4-day course here at the training center is the final course I've taken in my 3-year journey in biomimetics, and it's really put a lot of the principles I've learned into several other courses and many hours of training all together. So I wouldn't say I've learned many new techniques here, but all the old principles and science all comes together, so you become a better clinician now that you know the why behind some of the principles, behind wallpapering, or you understand there might be 5 different ways to stress reduce this restoration, and you can learn when and where and how to use it. And not only do you have the opportunity to do hands-on, you see Dr. Deliperi work on patients in the chair. So his patients, you get to see him treat very compromised teeth, and you get to see that done live. And just seeing that and being able to ask him questions as he goes through his normal protocol for these patients is priceless. So this has by far been the most comprehensive biomimetic CE course, and really a course just to learn how to work with aesthetics and just to learn a lot of comprehensive dentistry. And what we do is operative dentistry and rebuild tooth structure. So I would highly recommend this course to anybody interested in being the best possible dentist for their patients.
Okay, if I may ask you another question, how did this course change your biomimetic background, and what can you bring back home for your patient to give some more to your patient?
This course has really given me more of a go-to option on from a semi-direct or indirect, or more going toward an indirect and structurally compromised teeth. It's given me a better insight on how to do it direct, or and to do the stress-reduced restoration. So where I would previously more go to a onlay or even a 3/4 crown in the anterior on a nice bio base. Now I have the option, and in the severely compromised tooth, I can do a stress-reduced restoration for my patients. So it gives me another option to give my patients, that would be where I would be worried to do a indirect restoration. So possibly can save my patients from bridges or implants, especially in the anterior.
Thank you very much. It was a pleasure having you here.
My pleasure.